Hello, we are back for episode 2 of my Silver Lining series. I am going to go ahead and screen share here, put it in presentation mode, and we will get going. Hey, once again, if you're new to my channel, this is a Silver Lining series transforming my personal experience into your empowerment. And these are my recommendations based on personal experiences as a patient and a nurse. My name is Tiffany Smith. Today, we're going to talk about pain management, small things that make small differences and add up. And this is for people who are pre and post-op, any sort of surgery for their jaw, or really anything, but this is specific to my population with any sort of temporal mandibular joint dysfunction or pain. So today we're going to talk about non-pharmacological pain management, which means things that are not like pharmacology or medications, which includes behavior modification, low cost options, additional services options, and then we'll transition into pharmacological pain management and a note on medication safety. All right, so starting with non-pharmacological pain management, this includes behavior modification and some low cost options and some additional service options. For behavior modifications, I want to start with suggestions that are within our control and that are free. Because, we're spending a lot of money on this situation. So anything that we can modify that doesn't cost us anything is always a great place to start. So I want to start with a story. One of the things that has triggered my pain a lot, mostly preoperatively and then in the initial phases of my postoperative healing, was driving in a car because of the bumpy roads. Just the jarring and everything would hurt my joints and then my Le Fort incisions. So I discovered that if I sat in the passenger seat and like thought about every time we hit a bump, I found myself getting irritated and actually angry at my husband because even though he was being intentional about not hitting potholes and trying really hard, I would just sit there and perseverate on the fact that he was hitting all of them. So we made a change. We put me in the driver's seat. And this is metaphorical and literal. Putting myself in the driver's seat, one, gave me something else to think about so that I was focusing on driving instead of my pain. And two, it put me in control. So I now knew if we were hitting a pothole, it was because I was trying to avoid it and I couldn't help it. So I was in the same scenario, which is the bumpy car, yet I found that when we arrived at our destination, my pain levels were lower. So you can use this in a literal sense, but also just think about your life in general. What are situations that are triggering where you can put yourself in the driver's seat to give yourself like this feeling of empowerment and know that you are in control? The next thing that I found that has really helped was being mindful of my neck posture and my alignment. So this is true for like at work, when I'm typing on a computer, when I'm charting, phone calls. Not as many desk phones, like holding them like this when you're using your hands, like kind of turns your head and it hurts. So being mindful to not do that. If I was watching TV in a theater or at home, I did best when my neck was midline or straight and I wasn't looking up or down. Same thing with reading. I actually switched to audiobooks from reading hardcover copies because the looking down would hurt. So these are all things that I noticed made a difference in my pain. Next was doing stretching or exercises. And if you don't feel confident doing this on your own, there are some phenomenal YouTube channels that have great exercises that can specifically be focused on like neck stretching and like chest openers, but just movement in general has been so helpful for me. It is something that if you have restrictions on your movement, you'd want to run past your healthcare team to make sure that that was okay to incorporate into your day to day. But I have found that anytime I can incorporate stretching or movement in my day, it makes a big difference. That being said, there were certain movements before my surgery that I found inflamed everything. So pay attention to your body. If you do an exercise and you find you hurt worse, then obviously that wasn't the right choice to continue. I found low impact cardio options, so either walking, an elliptical or swimming were really good options. And then stretching is another one that really, really helps. But I found before surgery that if I put my arm like this and stretch to the side, it would actually shove my joint into that space where it hurt. So I avoided those postures in my yoga. Um, Yoga videos on YouTube. I love Yoga with Adriene. She is a beginner yoga instructor. She's so down to earth. She's so genuine, and I love her videos a lot. Another thing that I found helped was meditation apps and breathing exercises. My favorite app is called Insight Timer. There are tons of free options. There are, of course, in-app purchases. Um, but I found that I was clenching at night, which is really hard because you feel like you're self-sabotaging in a way you don't even know because you're unconscious. But listening to a meditation before I went to bed would actually help relax everything. And pain is as much physical as it is psychological. And so I found that if I could address the physical pain while also addressing the psychological processing of that pain, it helped. So doing breathing exercises, actually Googling or in my meditation app looking for breathing exercises that help with the vagus nerve, like calming down. You can search that specifically, and it helps. So, another thing with clenching that I found to be frustrating again was I was clenching at night, and I felt like I had no control over that. So, what I started doing was thinking, well, how can I fix something that I'm unconscious about when I'm doing it when I'm conscious as well? So during the day, I would pick some behavior I did frequently that would trigger me to think, is my face relaxed? So say it's taking a drink from your water bottle. Every time you do that, ask yourself, is my face relaxed? And every time I asked myself that, it was not. So I would like, you could almost feel your facial muscles like melting. Start asking yourself that multiple times during the day. And then when you're conscious, you're retraining those muscles to relax. And I found that impacted how I slept as well. I did have to modify my chewing as well, which is um, demoralizing. It's hard, but I found I was able to engage in work and in my life in general if I didn't chew things that triggered my pain. Because I didn't just hurt when I ate them, I hurt for hours afterwards. So you can maybe track your trends and notice what you're eating and if it flares your pain or not, and then modify that chewing, knowing it's not forever, but it is temporary and it's helping you get through this time. While on the subject of nutrition and chewing, I found that certain food items also flared up my pain. If I ate a diet higher in salt one day or another, I noticed my inflammation was worse, which then made my pain hurt more. I also found that sugar would make my pain hurt worse, especially post-op, actually. In the first few months afterwards, if I ate like a brownie or a dessert that had a lot of sugar in it, I would feel it right here. It was very weird, but I noticed it, so I made changes. And then alcohol can also cause a heightened inflammation or inflammatory state in your body. So just ask yourself and notice if that is contributing as well. Moving on to low cost options. So these are like devices or things that you can buy to help. One of them was, again, moving into driving in the car and the impact of the potholes. I bought I call it my butt cushion. It's like a compression relief cushion. It's called Comfy Life, COMFI, I think. Um, and it's just a padded cushion that I have in my driver's seat that helps absorb the impact of the bumps and it helped it not translate to my joints. I also added turmeric, magnesium citrate, and anti-inflammatory teas into my daily routine. Now, before you add any of these things, it is important to run all of that past your healthcare professional. Make sure that it's not going to interact with any of your medications, and that they're okay with you doing that. And you can Google anti-inflammatory teas, pain management teas, sleep support tea. Again, all of these little things add up with the consent and guidance of your healthcare team. Some people have also purchased special pillows to sleep with that help support their neck. And then lastly, I found that a humidifier really helped, especially in the wintertime. Speaking of that, sorry, I have a bit of a head cold, so you probably hear it in my voice. Um, Additional service options. So these are things that are going to cost a little bit more money and also more time with appointments. So these are things that I found helped with my pain management beforehand. And it is very important that you find a healthcare team that is aware of dysfunction in the temporal mandibular joint and is mindful of how unique that care is. So your surgeon or your healthcare team might be able to help you find these ancillary services, but they are very important, or at least they have been to me. So doing chiropractic work on my neck made a big difference for me, both before and after surgery. Acupuncture was huge for muscle relaxation through my scalp and my face. Um, Again, get permission from your surgeon, especially if you're post-op. Reiki is another one. This is more focusing on energy and how trauma or emotion can be trapped in certain energy centers in your body. Forest bathing is a practice that I actually became certified in, and it is a Japanese practice where you spend a couple of hours in guided meditation out in nature to help ground and center yourself. I have guided many teams over the last few years, and it has made a huge difference for me. It is a newer practice, but there might be forest therapy guides in your area that you can search for and go on one of their events. Massage is another one, but also very important that your massage therapist is conscious of your limitations. Cupping is, you might have seen that. It's another muscle therapy. Oh my gosh, I might sneeze. Sorry, guys. Um, so cupping and a TENS unit are another one. Lymphatic massage or lymphatic drainage. Myofunctional therapy and physical therapy are pretty standard for surgeons, especially post-operatively, to include in your recovery. But a lot of people find that being helpful pre-operatively too. And then last is like mental health therapy or coaching or counseling, because this journey is so multidimensional and integrated. I highly recommend getting a therapist to help with the anxiety component, the fatigue that comes with this journey, and just the how challenging it is to have every aspect of your life impacted by this diagnosis and treatment plan. Next, pharmacological pain management. So these are going to be actual medications, whether it be over-the-counter medications or prescriptions. And this, adding this into your daily routine is 100% something that your care team needs to be involved in. Um, so there's different types of medications that most people in our community find helpful. The first one is NSAIDs, which are non-steroidal anti-inflammatory drugs. That would be something like ibuprofen. There's analgesics, which don't work on inflammation, but they do work on pain. That's something like Tylenol. Um, there's sleep aids, both herbal or holistically, and also prescription wise. Muscle relaxers, same thing. And then narcotics is the final one. So anytime you are considering or your provider is considering adding any sort of pharmacological um, component into your treatment plan, I feel like it's important for us as the patients to be educated on those medications. So I have recorded a video that I might have to escape here and actually click on. It worked as a link last time I did this. Sorry, guys. This is a resource that you can use to research your medication. Medline Plus is a great resource for patients to search all about the medications they're about to start. So you'll want to go to the search bar, type in your drug. Here I had a typo, but I'm trying to type ibuprofen. Once you get it, select the drug, and then it's going to pull up a few different results. You can just click the one that has the title of the medication. Then you can scroll through and it's divided by category, so it's very easy to read. You can see why it's prescribed, how it's used, other uses, other precautions, dietary restrictions, what to do if you forget a dose, and side effects, which is the one I wanted to highlight here. So you can go through and look at the side effects for the drug. The reason this one is so important is side effects are one of the most common reasons people stop taking medications, other than it not being effective in the first place. So for me, once I started having a lot of muscle pain, I was started on Flexeril, which is also called cyclobenzaprine.
And I didn't know this was a side effect, but I started finding that I was excessively thirsty, which if you look at the very first side effect, it is dry mouth. So I was drinking between 4 and 5 liters of water a day because I was so thirsty. And because of that, we ended up switching. Medline Plus.
So I wanted to put this as a resource. That little video is available as a short on my YouTube channel as well, if you want to access it again. Um, I think it's very important to understand how medications act in our body and the side effects that they can cause. For me, at first I thought like, oh, the Flexeril was helping as a muscle relaxer, but I was miserably thirsty all the time. I didn't realize that there could be another option. So once I told my surgeon about it, we switched to a different muscle relaxer, and I had the same therapeutic benefit without the side effect that was pretty constantly irritating. So just be like pay attention to what your body's saying. If you notice a change, it could be the medication, and you can use this resource to check and see if it's a commonly reported side effect. Even if it's not listed as a side effect, please still mention it to your care team or your provider. It could be that you're just different. That's one thing I've learned as a nurse is that everyone is unique, and just because something isn't reported frequently doesn't mean it's not the cause. So um, advocate for yourself, listen to your body, and report everything that you notice to your care team. So, thank you guys for your time. I would love to hear other things that you've done to help with your pain management, both pre and post-operatively, and how they cumulatively work together to help improve your quality of life. Bye, guys. Thank you.